Conclusion. Therapeutic guidebooks propose many different approaches to treating depression. The concept of 3 pillars is neither new nor groundbreaking in itself. Each of these pillars has long existed in psychotherapy and medicine. Until now, however, they have rarely been treated as a coherent whole. This is precisely why I decided to describe and organize this method not as a theory, but as a practical model for working with depression. In contemporary psychiatry, there is a prevailing belief in the primary role of pharmacotherapy in treating mental illness. My experience and observations lead me to a different conclusion. Pharmacotherapy cannot be the only, nor the main, tool for reducing existential stress. Medications improve functioning and stabilize symptoms, but when used without psychotherapy and behavioral social activation, they often lead to dependence on medication and a state of psychological stagnation. Symptoms are suppressed, but their causes remain untouched. My thesis may sound provocative, but I consider it justified. Mental illnesses, when properly treated and consistently monitored, do not require lifelong preventive pharmacotherapy. Effective recovery from depression and conscious management of one's mental health make it possible to withdraw from unnecessary, long-term chemical intervention. This applies to the majority of mental disorders. The problem is that a significant portion of them are not treated correctly, not due to a lack of knowledge, but due to the lack of consistent integration of pharmacotherapy with psychotherapy and genuine patient activation. It must be acknowledged that physicians almost never recommend discontinuing medication in conditions associated with a risk of relapse. This largely results from healthcare systems that prioritize minimizing legal liability and risk prevention, often theoretical rather than real. The balance of benefits and losses is calculated conservatively, and limited access to psychotherapy further reinforces this approach. This is not a call to abandon neuroleptics. They are necessary during recovery and indispensable during periods of instability. However, condemning oneself to lifelong pharmacotherapy solely to be on the safe side constitutes an abuse of patient trust. This book exposes the biological mechanisms underlying depression and offers concrete, tested tools for mood stabilization and the restoration of motivation to act. These are not metaphysical speculations, but practical interventions targeting the nervous system through clearly defined methods. I am deeply convinced that, when applied appropriately, they allow for lasting recovery from depression, because they are based on understanding the illness and consciously regulating its symptoms. This book has guided the reader from recognizing depression, through understanding its biological and psychological mechanisms, to practical ways of regulating mood and restoring meaning. Each subsequent lesson gradually shifted the center of gravity from internal analysis toward relationship, responsibility, and action. Lesson 12 completes this process by showing that the most effective antidote to depression is not self-focus, but stepping beyond one's own narrative and entering into real contact with another human being. The mechanisms described in this book are not a therapy reserved solely for people with a formal diagnosis of depression. They concern the fundamental way the human psyche functions. Every person experiences periods of reduced energy, loss of meaning, fatigue with life, or a sense of being stuck. These states do not always require psychiatric intervention. Often, they are natural signals that one's current way of life has ceased to align with inner needs. These states can be regulated, not by intensifying self-reflection, but by changing the vector of attention. Exclusive focus on oneself, one's emotions, and one's thoughts quickly leads to entrapment in an interpretative loop that becomes a source of suffering in itself. Exiting this loop occurs when attention is directed toward real action and a real other person. Helping others is not a moral command or an act of altruism here, but a concrete tool for regulating the functioning of the nervous system. The caregiving relationship organizes the psyche because it imposes meaning from the outside. Responsibility, the necessity to respond, and being present for someone else stabilize emotions more effectively than most introspective techniques. Meaning ceases to be an abstract question and becomes a consequence of action. Motivation does not need to be manufactured, it emerges as a byproduct of engagement. This is why the mechanisms described in this book work regardless of a formal diagnosis. They are universal because they are grounded in the biological and relational foundations of human functioning. They do not promise permanent comfort or the elimination of suffering, but they allow suffering to be given direction and meaning. As a result, life becomes fuller, more grounded in reality, and more engaging, without excessive caution and without retreating into illusion. Which I wholeheartedly wish for you and for myself.